It's Tuesday, February 9th, and it's time for your Barbados Today morning news update. Two more highly trained healthcare providers have assured Barbadians that the Oxford AstraZeneca vaccine is a good choice for the country. Acting Medical Officer of Health Dr. Omar Edwards and Senior Health Sister Juliet Serrano gave the vaccine their stamps of approval during last evening's COVID-19 press conference. Serrano, who is the Senior Health Sister at the Brantford Tate Polyclinic and the chairperson of the local immunization committee, as well as a member of the COVID-19 vaccine planners committee, said one reason the vaccine was chosen was because of its adaptability to the local climate.
Presently, our capacity here in dealing with the vaccines, we can safely deal with the vaccines within the temperature range that we are currently dealing with. Right now, we deal with vaccines up to minus 30 degrees. The other vaccine, the Pfizer, that is sub-zero temperatures. So therefore, we have to put a lot of infrastructure in place to deal with that vaccine. And ideally, in a climate as like ours, that vaccine might not be the better choice.
Acting Medical Officer of Health at the Winston Scott Polyclinic, Dr. Omar Edwards, also explained why the vaccine was chosen.
There are many considerations in a country choosing a particular vaccine. There is also a global rush to acquire vaccines, but we have an excellent choice here in the Oxford AstraZeneca vaccine for Barbados, meaning that we have a vaccine that is thermodynamically stable for our climate. So the vaccine is stable up to 30 degrees Celsius. So we can deploy this in the field in our vaccination campaign. The vaccine has standard refrigeration requirements between +2 to +8 degrees Celsius. We are accustomed to this. All right, so our health system, our health sisters, they can handle this perfectly. All right, so when you consider a mass population vaccination rollout, you have to put a lot of things into context, okay? So for an effective campaign, we would want to deliver as many vaccinations as possible. We would like to cover all of Barbados, okay? So we need a tool that is effective, and that's what we are going to get. It is stable in our climate, so we can give this vaccine in our clinic. We can give this vaccine at an off-clinic site. We can do campaigns throughout the island quite comfortably with this vaccine, because it has already been mentioned, we are looking to achieve herd immunity. We want to get the vaccine out there to as much as Barbados, and we want to be able to offer it to all of Barbados, because it matters. If you achieve herd immunity, you can then move to decrease in country transmission of COVID-19.
Meantime, Barbados has been given a passing grade for its management of the COVID-19 pandemic. It's coming from Reverend Dr. Kirtley Yearwood, who is the coordinator of the COVID-19 vaccine program at two hospitals in Maryland, USA. Yearwood, a Barbados-born medical doctor, pathologist, and administrator, was one of the panelists at last evening's COVID-19 press conference.
Sure, Barbados is doing quite well. You did a very low positivity rate, a very low death rate. You're doing extremely well. It's always easier for a smaller nation to lock itself down and isolate, and therefore I've been very impressed with the measures taken by the government and others to curtail the spread of this disease.
Dr. Yearwood also called on residents to adhere to the health protocols put in place.
We have to say, however, that we are human beings. Staying in lockdown and lack of socialization is hard on people. It's natural to want to get out and mix and mingle with your friends and family. So it's challenging, but it's so very, very important for people to maintain those measures as a way to curtail the spread. If we relax ourselves and start hanging out and partying and going to the various ram shops, etc., we have the tendency therefore to spread this disease even more. You cannot see the enemy. That's why it's so hard. When you put on a mask, you're protecting yourself as well as your neighbors, mainly your neighbor. We could have this disease and not know we are transmitting it. Once you've had the vaccination, you still may have the disease. You're just not likely to get as sick to be hospitalized. You can still spread. Hence, it's important, even when you do receive the vaccination, to maintain the social distancing, wear the mask, wash your hands. We're going to be in this posture of mask, washing hands, and social distancing for months.
In other news, the Democratic Labour Party welcomes the proposed introduction of a national minimum wage in the country, but is concerned about its timing. In fact, the DLP's first Vice President, Ryan Walters, is suggesting that if the measure is implemented by the April 1 target date, it could result in more joblessness. Government is proposing a national minimum wage of $8.50 per hour and a sectoral minimum wage for security guards of $9.25 per hour.
The Democratic Labour Party unequivocally supports a national minimum wage. The DLP has always fought and will continue to fight to protect the working class within our society. But we are asking the government, is the timing right? While we agree with a national minimum wage, we would hate to see more hardworking citizens lose their jobs in this economic environment. The government cannot pave the way for more households to be without an income. The truth is, the state does not control the private sector and cannot say with any surety that this would have adverse implications for employment. The questions we have to ask: will more jobs be lost? Who will re-employ these persons on the bread line? Will the adversely affected persons qualify for unemployment benefits? And does NIS have the money to pay them? The timing of seeming to increase minimum wage is poor and is being advanced when most of the population is unemployed.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region, St. Lucia's Prime Minister Alan Chastanet is heading to Parliament today to seek an extension of the state of emergency currently imposed on the country for a 90-day period. The Prime Minister made the announcement last night during a special address.
This has become necessary as COVID cases regrettably continue to rise. In this, our third wave of the pandemic, we've had over 1,000 cases, most recorded in January alone, with far too many lives lost. The situation is worrying, with many of us continuing to disregard health and safety protocols, though I must commend the vast majority of our people for complying. I know the times are not easy, and it feels unnatural and uncomfortable to wear a mask all the time. But it's much easier to breathe with a mask than to breathe with a ventilator. This is why I continue to call upon you to be resolute and to remain committed in our battle against COVID.
And finally, the UK variant of the coronavirus is now rapidly spreading in the United States, and the Centers for Disease Control and Prevention is predicting that it could be the predominant strain in the country by March. More from Reuters TV.
Despite trends moving in the right direction, we remain in a very serious situation.
U.S. health experts on Monday said that the number of COVID-19 cases and hospitalizations have dropped sharply in recent weeks, but warned that both are still at dangerously high levels, with a more transmissible variant of the disease first discovered in the UK possibly becoming the dominant U.S. variant by the end of March. The Centers for Disease Control Director, Dr. Rochelle Walensky.
The continued proliferation of variants remains of great concern and is a threat that could reverse the recent positive trends we are seeing. Please continue to wear a mask and stay 6 feet apart from people you don't live with. avoid travels, crowds, and poorly ventilated spaces, and get vaccinated when it's available to you.
The number of COVID-19 cases last week dropped 20% from the week before, and last week's hospitalizations dropped 17% from the week prior. But both are still at levels higher than they were last summer and fall. And the UK variant, first detected in the US at the end of December, is now in 34 states and spreading quickly. Top infectious disease expert Dr. Anthony Fauci echoed the two-tiered regimen of strict protocols and vaccinating the public as quickly as possible to protect against emerging variants.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.